I am going to check the nasal examination. These are the apparatus required: otoscope with large speculum, pen light, scale, and sanitizer. I introduce myself. I am Karpadesan Hariharan. May I know your name, please?
I am Sabari.
Okay. I am going to check your nasal examination. Is that okay for you?
Okay.
Do you have any past history of nose surgery or anything?
No.
Do you have cold?
No.
Okay. Now I am going to check the nasal obstruction. Breathe out. Breathe out. Okay. There is no nasal obstruction. Now I am going to see the symmetry of nose and deviation. Nose is symmetry and there is no deviation. I can't find. Okay. Now I am going to palpate the nose. Bridge, dorsum of the nose, tip of the nose, ala of the nose, and anterior nares of the nose. Do you feel any pain?
No.
Okay, I use otoscope for checking the inferior turbinate, middle turbinate, and the nasal spectrum. So there is no swallowing, there is no bleeding. Nasal spectrum is midline and there is no inflammation. Now I am going to palpate your sinus. If you feel any pain, inform me. Do you have any pain?
No.
Okay. Now I am going to check your maxillary sinuses. Do you feel any pain?
No.
Okay. Now I am going to check the trans illumination of maxillary sinuses. Can you please open your mouth? Okay, sinuses are good, there is no obstruction. Now I am going to check the oral pharynx examination. These are the apparatus required: pen light, gloves, gauze, tongue depressor, tissue paper, sanitizer. I am going to check the oral pharynx examination. Is that okay for you?
Okay.
Do you have any dentures?
No.
Do you have any past history of pharynx surgery or anything?
No.
Okay, now I am going to inspect the lip. It is where I can see the vermilion border, lips colors are normal and it is moisture. There is no lumps, no cyanosis. Now I am going to open inside the lip for seeing any lumps. I can see the labial formulum and there is no lumps and no ulcer. Now I am going to inspect the teeth and gums. Can you please show me your teeth? I can see the teeth color, it is normal and teeth are properly aligned. The border gums are normal. Can you open your mouth please? For that I am going to check the looseness of teeth or any missing teeth. I do not found any missing teeth or looseness of teeth. There is no gingivitis. I am going to examine the oral mucosa. Sir, can you please open your mouth? There is no cyanosis present. Now I am going to check the roof of the mouth to inspect the color and hard palate. Can you please open your mouth? There is no abnormalities present. Now I am going to check the tongue and floor of the mouth. Can you please put out your tongue? Okay, the tongues are symmetrical, there is no deviation. Now I am going to hold the tongue with a piece of gauze paper. Can There is no ulceration or any cancerous lesion. Now fold your tongue. I can see the lingual frenulum. There is no deviation of the floor of the mouth. I am going to examine your pharynx. Can you open your mouth and say ah?
Ah.
I can see vulva. It is symmetrical. No deviation are present. I can see the anterior and posterior pillars, and also I can see the rising of soft palate. No tonsil are present. I am going to check the cock reflex. I am touching the posterior part of the tongue with the tongue depressor. Sometimes it may feel like vomiting. Is that okay for you?
Okay.
Please, can you open your mouth? Okay. Now I can dispose the tongue depressor. Now oral pharynx examination is done. I am going to do the neck examination. The apparatus required: stethoscope, pen light and sanitizer. I am going to check the neck examination. Is that okay for you?
Okay.
Do you have past history of neck pain or neck surgery?
No.
Okay. Now I am going to inspect the neck. Neck is symmetrical and trachea is in midline. Now I am going to palpate the lymph nodes. Pre-auricular, post-auricular, occipital and tonsillar, submandibular and submental, superficial cervical, posterior cervical, deep cervical chain, superficial cervical, posterior cervical, deep chain cervical and supraclavicle. No enlargement in the lymph node. Next, I am going to check the trachea. Sir, can you swallow? Okay. Trachea is in midline. Now I am going to do the auscultation. Sir, can you breathe out? Okay. Now I am going to palpate the trachea. Thyroid cartilage, cricoid cartilage, thyroid gland. Now I am going to do the deviation of trachea. No enlargement in the trachea. Now neck examination is done. Do you need any clarification?
No.
Thank you for your cooperation.